The SEAL Pin to bar system, especially in the Delta configuration for lower extremity trauma, falls perfectly in line with the other SEAL products. We've talked about the circular frame, the small rail fixator. This is a marriage in the trauma aspect where you have other products that SEAL will utilize for trauma, such as the speed frame, falling into more of a acute orthopedic lower extremity trauma scenario. Patients are extremely complicated, they're extremely high risk. Many times the trauma to the lower extremity is not the only injury these patients sustain. High energy impact accidents such as car accidents or motorcycle accidents or pedestrians being struck by a car or injuries fall from heights can result in not only lower extremity trauma but also trauma that it travels up the spinal column, the back, the neck, and patients can often have head trauma. So speed is important when we're dealing with fixation of these patients. We would need to get these patients the least amount of anesthesia, but the optimum fixation, optimum stability to then be able to stabilize this patient, especially in this acute traumatic reconstructive treatment period in the first day, in the first few hours. So these patients do need what the SEAL products offer, and the Delta configuration, especially in the pin to bar system, falls right in line with that benefit that we've seen with the other SEAL external fixation products. There is again no compromise with our anatomic fixation. You do not need to have the fixator dictate where your pins will be placed. You place those pins in the optimum anatomy, and many times these patients will have reduced optimal areas due to this trauma. If an area we want to place a pin has gross fracture, we can't place a pin there, so we need to go to the next best place. And if the fixator doesn't allow that, we can get stuck. And the SEAL fixator overcomes this and allows you to place your pins where you need to place them to quickly fixate these patients, not just in one plane, but all three planes or all three angles that this deformity usually is in.